So today we're going to talk about your nose, and we're going to talk about rhinoplasty, which is just nasal surgery. When you look at somebody's face and you think about it, the nose is really kind of the dominating feature of the face. And the key to doing a good rhinoplasty or nasal surgery is to change the nose in subtle ways where you don't change the character of the face. So let's think about this and break it down a little bit. Look at your nose, and when you do, you break it down into three sections. Sort of the top, the middle, and the bottom from the front, and then we'll talk about it from the side, top, middle, and bottom. Looking straight on our nose, what can be problematic in terms of the way the nose looks? Well, it can be too wide at the top or the middle part of the nose, and down below, particularly in the tip, it can be too round, it can be too boxy, and the edge of the nose, sort of the alar wing here, can have too much flare to it. And that's frequently something that bothers people as well. Now turn to the side. It's kind of hard to do this. You have to have two mirrors when you look at your nose to do that. And look at your profile. Again, thinking about thirds. The upper and middle third can be too prominent. They can stand out where you have too much of a hump. They can be too excavated where there's just too much of a hole and something needs to be filled in that area, or they can be too wide in that area as well. The third place is the lower part of the nose, which is the part where people are frequently not happy with the way their nose looks. And think about the lower third in profile. It can be too projective where it stands out too much. It's just basically too tall. It can be too hanging where it plunges down, and it would look nicer if it had some rotation, although not too much rotation, because that can be problematic as well. So that's a very simple way to look at the nose and think about different ways that you can impact a nice change.